Welcome back, everyone. Today, we're going to talk about week 1 through week 2 post surgery of my Achilles rupture. We're going to talk about what the surgery was like, what you can expect shortly, a few days after the surgery, how much pain you're going to be in, what quality of life is like, and how to get around. We'll also talk about when you can expect to get the cast removed or the stitches removed, and when you can expect to start physical therapy. So with that being said, let's dive right into it. All right, so the first thing we're going to talk about is what is the pain like when you get out of surgery. So right away when I woke up from the anesthesia, I was feeling severe pain, so I had to get extra painkillers or pain medication through the IV at the hospital. I've had many sports injuries. I've also had many surgeries, and by far, this is the worst when it comes to pain. For the first 7 to 8 days after surgery, I would rate my pain of about 7 to 10. This is how bad it's been. So I would recommend that you guys stay on top of those painkillers. I was using a lot of aspirin, and I think they prescribed me hydrocodone or something like that. So if you can stay on top of those pain medications, that would be great. When it comes to managing this pain, elevation is going to be your best friend, and ice. Now, it's going to be really weird to try to ice because your cast is all the way up here, and the only place you can really place the ice is right underneath your calf muscle, which, it doesn't really do much. So I don't know, it's kind of weird icing with that big cast on, but if you can find a way to ice, I would highly recommend it. That's going to be your best friend. One of the things that will make your pain worse is going to be when you get up to walk around or to get up and go shower, because anytime you have that leg hanging and not elevated, you have all this blood that rushes down and it causes severe pain. For example, when I go to shower, I don't have a chair that I sit on, so I basically stand the whole time that I'm showering, which turns to be very painful on the foot that I just had the surgery on, and it gets very tiring on the one leg that I'm standing on. So if you don't have a plastic chair that you can place in the bathtub, I highly recommend getting one. You're gonna need it for the next 2 weeks or so. When it comes to getting around the house or just moving around, you got two options. You can either go the scooter route, or you can use crutches, or you can use both. So I got both just because they recommended for those long distances when moving around that the scooter was better. And then for moving around, pretty short distances like around the house, maybe the crutches are the way to go to. I got both. I did not end up using the scooter at all. I mainly used the crutches. However, I would recommend getting both because when you have the scooter, you can put your knee on there and you can push it with one hand and use your other hand to carry things around the house. So it becomes a little bit useful as far as you being able to do things. Here's a nice example of what it's like to use the scooter. You can just use one hand to push it around the house and then use the other hand to carry things. So this is how easy it is to use the scooter. With the crutches, it's a little bit difficult because you're using both of your hands to move the crutches and you're not able to carry anything. So if you want to help yourself out, maybe get yourself a drink or put some food on the table for yourself, then the scooter is going to be very helpful. As with the scooter though, as far as using it outdoors, you have to be very careful. It does go pretty fast, and on top of that, all the cracks and rocks on the cement, on the pavement, any uneven surface is going to be really dangerous. It's easy for you to flip over. I was taking out the trash and I almost flipped because the pavement in the parking lot was not even. So that was the only time I took it outside. I never took it outside again. I've mainly used the scooter indoors. So if you can stick to doing that on flat surfaces, I highly recommend it. And if you've never used crutches before, this is how difficult it is to use them or to get around the house. So I highly recommend getting both. Now, as far as when the cast comes off, for me, I got that off 12 days after the surgery. I did not get the stitches removed. What's going to determine when you get the stitches removed is how big of an incision you had. So for me, my incision was pretty huge. I think it was like almost 8 inches long. And just because of that reason, they said they were going to remove the stitches 4 weeks after the surgery. I later on ended up requesting it to be removed 3 weeks after the surgery just because it was bothering me a little bit as far as moving around or trying to wear sacks. So I had that removed 3 weeks after the surgery, but typically they said depending on how big the incision site is, it'll determine whether to remove that at 2 weeks or 4 weeks after the surgery. So, sometimes they'll do the surgery with just about an inch or two of an incision spot, and sometimes it's pretty huge depending on how severe the rupture was. Getting the cast off was so far the most positive and happiest thing that has happened since I ruptured my Achilles, because now, you don't have to worry about putting a trash bag over your leg when you're going to shower, so you're able to shower without covering that incision site. Another thing also is you can move your foot around now, so you can begin those range of motion exercises, kind of like forming a circle with your ankle. So I'll demonstrate here. Just kind of moving your ankle around. You're able to do some of those exercises to increase your range of motion. So just the freedom of being able to move your foot around makes a huge, huge difference. And by far, this is the most positive thing that has happened since I ruptured my Achilles. I am cleared to start physical therapy at exactly 2 weeks post-surgery. So I have that scheduled in a few days. So I'm very excited to start that, and I'm very excited to start this recovery journey. Stay tuned. I'm gonna upload my first video on how physical therapy goes. So stay tuned for week 2 video.